A doctor fighting on the front lines of the coronavirus pandemic has an optimistic message.
As our Lucy Bustamante explains, Dr. Jamie Garfield says the COVID vaccine is not the only game changer in the battle against the virus.
I feel a little bit more positive this time than some of the previous times that we've spoke.
The reason? The COVID vaccines.
There's no question that this is the next page of the COVID pandemic. I don't know how many pages this book is, but having a vaccine is game changing.
Although Temple ER Dr. Jamie Garfield says the vaccine rollout has been confusing.
Everyone has slightly different rules, and in an urban city like this, where there's neighboring states are very close to one another. People live in one state and work in another state. It's very confusing because it's unclear which guidelines are going to apply to which person.
Regardless, Dr. Garfield wants everyone to get a shot.
These vaccines save lives, and whichever vaccine is made available to you, you should take any vaccine in your arm.
She got her vaccination and says that while there can be side effects, people do not need to worry.
I got my second dose and I felt a little bit sick. I had a bit of a fever and I felt a little run down. It was less than 24 hours and it was done. And that's not unexpected. We know that from the Pfizer vaccine and the Moderna vaccine, there is a significant percentage of people who will develop some side effects related to their bodies.
Dr. Garfield reminds us that just because we get the vaccine, it doesn't mean that we should let down our guard. So keep wearing those masks.
But what we don't know is whether or not I can still get infected and if I can still spread it. And so because we really don't know whether it's possible for the gross majority of people who have been vaccinated to get infected and continue to spread it, it means that we're all still vulnerable until all of us are vaccinated.
But besides the vaccine, the doctor tells us an antibody treatment has been another game changer. It targets a protein on the surface of the coronavirus.
It's called the spike protein. It's actually the same protein that is targeted by the vaccines, the two vaccines that we have. And so it is an antibody that blocks this protein on the surface of the coronavirus, and that protein is how that virus gains access to the cells.
She says this treatment can help reduce mild symptoms from progressing to more severe outcomes.
The data would suggest that there's a significant reduction in hospitalization and mechanical ventilation and death with these therapies, up to 50%. That's huge. That's a huge difference to reduce death by 50% with the use of these antibodies.
And what a huge difference 10 months makes.
This conversation that you and I are having is so different from any of the conversations we've had before because we didn't have a light at the end of the tunnel. We didn't have a way to prevent illness, hospitalization, and death, and now we do.